and I don't think there's a way out of it. I think that you can't, they say you can't jump an abyss in small steps. The only way to get single payer is to go to single payer. And I'm afraid that we're looking at an option that is just not going to work. It's going to fail. Now are people going to, will the American people flood into the public option? We have a model. We have private Medicare and public Medicare. Which way are people going? 23 million people have abandoned public Medicare for the private Medicare because the private Medicare is subsidized and they can offer extra benefits. I always tell the story, my father, who was 96 and had Alzheimer's, used to get cards in the mail from Loveless and Presbyterian. And what did they say? Join our plan and you can get insurance coverage when you're overseas. And you can join a health club. Now, what elderly people are interested in insurance when they travel overseas in a health club? Not my 96-year-old dad with Alzheimer's. So they are attracting the healthier. They're cherry picking, that's the terminology. And there's no way on earth that any private company can be prevented from doing that. In fact, for Medicare, it's illegal. It's explicitly illegal to pick people based on their health status. And yet we know, because we have tons of data for Medicare, that they've been doing this for the 25 years we've had this private, it's called Advantage. So it can be done. And the American people, if there's advertising, if there's various ways of enticing people into the private plans, the healthier will go into private plans, and the sick and disabled will be in the public plan, and it's going to lose money, and you know what everyone's going to say? Aha, we told you, the public plan's not going to work. So let me say what principles we can't compromise on. We must get profit out of healthcare. Healthcare is a public good. We need to get the profiteers out. Only single payer will do that. We need real choice. We need one level of health insurance for all Americans, not tiered health insurance. People talk about the federal employees benefit plan that Congress has. Hundreds of thousands of federal employees can't even afford the premiums. That's not a model system. If you're a senator or a congressman, you afford the best plan with the lowest copays. If you're a lower paid worker, you have high deductibles. That's not a model for a national health plan that I want to have any part of. Universal coverage means every single American. You sign them up at the time they get medical care, right on the spot. Now we're talking about the public option.
In the delivery room.
Or the delivery room. That's right. Everyone means everyone. And now there's talk about only 36 million uninsured still being present, because of the incredible costs with the public option. Taxing, payment through progressive taxation. Let's be science-based. For the last 8 years of the Bush administration, somebody's personal beliefs trumped science and evidence. Well, let's go back to science and evidence. Is there a shred of evidence that a so-called public option is going to work? There's none. We have decades of evidence from around the world that single-payer public insurance plans work. I got 3 minutes. They work for everybody. Thank you. Finally, we need to be a democracy. If the American people want single payer, which has been shown in poll after poll, when they're asked the question, the New York Times poll last week didn't ask about single payer. Right? It didn't ask about it. When the American people are asked, do you want Medicare for all, improved Medicare for all? My colleagues are calling it Medicare 2.0, right? Improved, expanded Medicare. Most people say, of course. Isn't everyone's goal to hit 65 and get on Medicare? It's certainly my goal. So if the American people want this, by the way, American physicians, 59% support single payer. In New Mexico, a plurality on a poll taken by the Medical Society in January supported single payer. Does the AMA support it? No. This was a poll of mostly members of the AMA. They don't even speak for their own members. The AMA has shrunk. They're like, I think 20% of physicians, and they don't even speak for their own members anymore. And do nurses support single payer? You bet they do. California Nursing Association is the leader in this. So, why do the special interests always get their way, and why don't we get our way? If we're a democracy, single payer should be discussed every time healthcare reform is discussed in Washington. The Congressional Budget Office must cost out single payer in comparison with any plan the Democratic or the Republican Party puts up. Okay? And then we all need to pressure our legislators, like Mr. Lujan, who has signed up for 676, the single payer bill. We need to ask Tom Udall, I saw him this afternoon, and asked him to support Senate Bill 703. We need to ask our legislators to support it. But if we keep our mouths shut and we compromise our principles, let me just say this. Politicians are going to have to compromise. The question is, should we also be compromising? I'm speaking for patients who have no voice. I feel I cannot compromise my principles on this. And I urge all of you to not compromise, to insist on the single payer system. Whatever comes out of Congress, and I have a feeling nothing may come out, we need to build a movement for the best, the only solution, and the fairest solution. That's it. Thank you.
How do I follow that? My name is Nandini Keene, and I'm a health policy analyst and have worked in healthcare for about 35 years. Now, Bruce and I are very good friends, and we have promised to remain friends through this whole debate, and I'm going to do that, Bruce. So, the reason I think you're getting a small indication of where I'm going here is I have lived in single-payer systems. I lived in Canada for 8 years. I lived in Australia for 4. I love the single-payer system. I'm not afraid of it at all. But what I worry about, can you now, sorry, raise your hand if I fade away. What I worry about is whether it's too late for us here, but I don't want to get into a huge debate around that. My hope is that we get health reform this year, that the status quo is absolutely untenable, that losing to the Republicans is untenable, and that if we come out of this with the same old, then we would have all failed. So I'm trying to eke out a win-win here, somehow. And just in terms of reiterating some of the cost issues, we spend more than just about any other country on healthcare, over $1.8 trillion. In New Mexico, our single premiums are $4,500 a year. A family of 4 pays around $12,900 a year. So that's over $1,000 a month that it costs an average family. The Mathematica study that was done in 2006 said that only 50% enroll in employer-provided health care. Huge numbers of New Mexicans have no insurance, and about half of them are entitled to publicly funded programs but don't sign up for it. The other half are working, but their employers don't provide them with health care. So we've got a huge crisis in New Mexico, and we can't fail because we can only tolerate one solution. And that's what I'm here to say. If we could have the ideal, absolutely ideal single payer, and I'm suggesting to you that we don't have to compromise on the end result. I mean, ultimately, we've got to make sure that everyone gets covered.